Hello everyone, in this video we are discussing the popliteal fossa. As you can see here, this is a diamond shaped structure which is present on the back of the knee. Okay, so popliteal fossa is present on the back of the knee. Okay, now if you see it very clearly, so this is the anterior side and this is the posterior side which we are seeing the popliteal fossa, and it is at the end of femur and start of tibia. Okay, so in between them the popliteal fossa is present. Now, if we go for the boundaries of the popliteal fossa, so the muscles are forming the boundaries. Okay, so this will be the lateral side and this will be the medial side. Okay, so on the lateral side, if we say, so the biceps femoris. Okay, so the biceps femoris is forming the superolateral border. Okay, superolaterally bicep femoris is present, and if we talk inferolaterally, so there is the lateral head of gastrocnemius muscle. Okay, inferolaterally we have lateral head of gastrocnemius muscle. Along with that, we have plantaris also here. Okay, as you can see here, this muscle, this is plantaris. So plantaris plus lateral head of gastrocnemius, these are forming the inferolateral borders of the popliteal fossa. Now, if we talk about superomedially, so supromedially we have the muscles like this. You can see this is semitendinosus. Okay, so this is semitendinosus, semimembranous is there. Then we have gracilis also. Okay, then sartorius is also forming, and behind this we have adductor magnus also. So these muscles in all total form the supromedial border: semitendinosus, semimembranosus, gracilis, sartorius and adductor magnus. Now if we talk inferomedially, so as their lateral head of gastrocnemius was forming, here medial head of gastrocnemius muscle is forming the inferomedial border. Here also you can see in here same diagram. This is a diagrammatic representation of the boundaries of the popliteal fossa. So I hope this is clear. Okay, now we are going to talk about is the roof of the popliteal fossa. Okay, now we have discussed the boundaries, now we are discussing the roof. So obviously it will be having deep fascia, okay, superficial fascia. Then along with that we have is small saphenous vein. By mistake I have written great saphenous vein. It is not great saphenous vein, it is small saphenous vein, which is also the part of roof. Okay, along with that we have three cutaneous nerves. Okay, three cutaneous nerve are forming the roof. So this one you can see, this one, this is the posterior, this is the posterior cutaneous nerve of thigh. Okay, then here this one, just close to the small saphenous vein, you can see the nerve which is the medial cutaneous nerve, and then there is one that is sural cutaneous nerve. Right, so these three cutaneous nerves are also present in the roof. Okay, along with small saphenous vein, these three cutaneous nerves. Same the diagrammatic structure you can see here. So peroneal is also known as sural cutaneous nerve. That's the same thing, right? So this is very clear here. Now we are going to discuss the floor. There is not much in the floor of the popliteal fossa. Only the we can see is the popliteal surface. Okay. Then we have the capsule of knee joint. So these two are forming the floor along with the popliteus muscle. Okay, so this is only the floor of the popliteal fossa is. Okay, here you can see there the floor is also shown by the diagrammatic popliteal surface of femur, capsule and the popliteus muscle. That's all the floor is all about. Okay, now if we discuss the content, so the content is important. So we have is the popliteal artery, right? Then we have is the popliteal vein. Okay, popliteal artery, popliteal vein. tibial and common peroneal nerve. These are the contents. Along with that, we have is the posterior cutaneous nerve of thigh. Then we have genicular branch of obturator nerve and lymph nodes. Okay, so these are all the contents. You can see here. It will be a little bit difficult, okay, from this point of view because there are so many things. But we will be seeing, you can see this is popliteal artery. Just there you can see the popliteal vein also. Okay. Then you can see the tibial nerve. Then along with that you can see there this one, these are the common peroneal nerve. Along with that you can see the lymph node is also there. Okay, so these are the contents. Now there is some confusion regarding where is the nerve, artery and vein present. So here you can see there are three parts we are going to divide this. Okay, so on the upper part, middle part and the lower part, where is the location of the vein, artery and nerve. Okay, so upper, middle and the lower part. So you can see that in the upper part you can very clearly see, it's very clear from here. So if we go from medial to lateral side, that is, we can very clearly see that there is artery present, then there is vein present, and then the nerve is present. Very clearly you can see, okay, this diagrammatic way. Now if we go to the middle part, it is not from medial to lateral, it is from behind to forward. Okay, as you can see they are stacked one on each other, right? So you can see we cannot see artery in this, obviously, you know. So no artery is seen, we can see vein and nerve. So obviously if we go from forward to behind, okay, so forward to behind we can see that we can see nerve is there, then there is vein and there is artery also. Now if we come to lower part, same, medial to lower part, you can see that nerve is seen, then vein is seen and artery has come to the lateral side. So it has like shifted from there. So this is what the confusion in most part of the popliteal fossa is. Similarly, the diagrammatic way is the same thing which I have told you, okay.